We would like to introduce ourselves. My name is Agnieszka Tarnowska. I am a dentist. I used to work as a dentist. Nowadays I am working as a psychologist and psychotherapist, cognitive behavioral psychologist, psychotherapist.
My name is Agnieszka Pacyk. I am a dentist and also a university teacher. Agnieszka, what we can do with the young patient that it will become the cooperative adult patient in the future. So let me ask you a question. When and how the first child contact with the dentist should look like?
Researchers agree that a lot depends on the first visit and how often the child comes to see a dentist. If the first visit is caused by a toothache, for sure the child's anxiety level will be very high, and the accompanying pain will be obviously unacceptable.
That's true.
Yes, and likewise if the child rarely visits the dentist's office. So then, in that case, we have a ready prescription for dentophobic, the patient with dentophobia. So we know that regular visits in dental office affect the emotional process of coping with aversion to dental procedures. And if you imagine that we regularly expose a patient to aversive trigger, which in that case will be visiting a doctor, with time, consequently, the level of anxiety is going to decrease. And from the psychology point of view, we call it systematic desensitization, in other words, classical conditioning.
So how can we protect our child from the trauma visiting the dentist?
Agnieszka, I don't know, do you agree with that there are different ideas when is the right time to make a first visit with a child?
Yes, let's try.
Some dentists claim that it should take place just after the eruption of first teeth. Some think that it should be around first child birthday.
Or during the pregnancy.
Or even during the pregnancy, even earlier, right. But no matter when it will take place, the so-called adaptation visit, so during this visit a child gets to know hopefully in the stress-free atmosphere. He learns how to brush his teeth. He takes part in different plays and activities that will make him familiarize with the dental environment, with the dental staff, with dentists. So importantly, that the child could be able to sit on dental chair by his own, so by himself.
It's important.
This is very important. And play with, for example, like a mirror or a dental camera, intraoral camera, something that is interesting for him. So, and in that case, if the child has a positive memories of the first visit, I think that they are obviously more likely to come for the next visit.
Yes, exactly. However, all these factors you mentioned are independent of children because usually their parents arrange everything, each then medical appointment. So my next question is how to educate the parents of young children to shape their attitudes towards the future treatment and contact with medical staff.
It seems that the attitude of the parent is fundamental and decisive in this process. Parents' fear of the dentist has also been shown to influence the fear of children, the development of fear in children. So especially if they have never been to a dentist before. So we know from different data that especially mothers,
Yes,
as a primary
you are right.
caregivers of children, especially mothers with, say, depressive disorders or anxiety disorders, so they have a negative impact on children's perception of anxiety-causing situations, and are responsible for giving a negative signals that shape negative and anxious behavior patterns related in general to medical care. So if, for example, a kid hears from his mom, don't be afraid, or it will not hurt you, so the right hemisphere of our brain has no possibility to process the negative communications. So the right hemisphere hears, be afraid, it will hurt you.
It will,
So
it
this
will
is
be painful.
Yes, it will be painful, in other words. So it is very important what to tell and what not to tell children in terms of not increasing the level of anxiety. So if, for example, a mother scares a dentist saying, if you would eat so many sweets, you will go to dentist. So for sure, these children may be ill-disposed and uncooperative. So therefore, it's very important to interview parents about their own dental anxiety and teach them how to avoid how to not avoid dentist office, and how to convey confidence of the child, not the uncertainty with their attitude. Agnieszka, it's commonly known that the painless procedure is the key to gain a child's trust. What can help us? What can we do to process it in a stress-free and painless procedure for a child?
From the pain reduction point of view, it's very, very helpful to use good topical anesthesia. I believe that still is underestimated medical drug, because most of the dentists sometimes avoid to use it. But topical anesthesia is crucial, because we can reduce any discomfort which could appear during the injection. And during this proper time, let's say 2-3 minutes, we can start to create a positive atmosphere, to talk to the child, and also to be attractive to the child. That's why.
In what way? Can be attractive.
Yes, that's why I am the fan of children movies, for example.
Can we talk for a while about fear of needle, as we know that this is a really big problem affecting around 15% of the population?
Yes, of course, it is. But I have to mention that the metal syringes are responsible for making this first very bad impression, even on the calm child. So it's good to know that we have on the market completely new solutions. In the past, we often used the colorful caps which cover the metal syringes. But now this best solution is called generally safe syringe, and with my private experience, this is the best what we can offer the dentist to completely hide the needle during the procedure.
Maybe we can show it to everyone.
This is how the metal syringe looks like, which is the most popular equipment in making dental anesthesia, and this is so-called safe syringe. So as you can see, the needle could be covered with the transparent cylinder, so you can manipulate in the operation field, and for the child the needle will be invisible.
It's true that the safe syringes are the best, especially when we deal with young patients and additionally anxious patients. Sometimes Unfortunately, there are situations where the best equipment, our empathy, our special way of communicating with people,
Soft skills.
yes, calling soft skills, they are not enough. And in that case, what we can do, we can use a pharmacosedation. And please take note that midazolam giving prior to the visit could be very helpful solution.
Yes, that's great that we have in dentistry such kind of possibilities. It's worth to remember about it and share this information. Of course, in turn, the nitrous oxide is very safe when we are talking about the periodontic dentistry and attractive. So even if the child is at the beginning afraid a little bit about the equipment, we can borrow this mask and the child could play at home with this mask. So when during the next appointment we'll come back, there is no any difference with cooperation. So it's very good trick to use this. As a dentist, I have to say that we are often so focused on our technical skills that we lose sight of the most important, one of the most important aspects of practicing dentistry.
Because we have no time to talk. Yes.
Yes.
So
this is the patient perspective. Yes. So treating patient with the utmost concern for their anxiety, fear, and comfort, we prove to be a win-win situation for both, for the dentist and for the patient.
Yeah, so I think we should wish ourselves and other dentists to have cooperative patients, young patients, but first of all, well-educated parents.
Exactly.